Today we're going to talk about something millions of people struggle with every single day: chronic phlegm and mucus in the back of the throat. You know that constant need to clear your throat, that feeling like something is stuck back there, the coughing at night, the post-nasal drip that never seems to go away. Most people think it's allergies, a sinus issue, or maybe just getting older. But what if the real cause has nothing to do with your throat at all? See, if you really want to understand this problem, you have to think like an engineer, not just like someone trying to suppress symptoms. Because modern medicine often labels symptoms as diseases. You get diagnosed based on what you feel, then prescribed something to shut the symptom down. But very rarely does anyone stop and ask, what's actually causing this? So today, I want to trace this symptom, chronic mucus production, back to the most likely root cause. Now, if you deal with this issue, you probably also experience a few other symptoms: post-nasal drip coughing, especially at night, hoarseness, a scratchy throat, the sensation of a lump in your throat, irritation when swallowing, sometimes even trouble breathing. And one of the biggest clues is that these symptoms usually get worse when you lie down. That's important, because in many cases, this problem is connected to acid reflux. Now, most people have heard of GERD, gastroesophageal reflux disease. That's where acid comes up from the stomach into the esophagus and causes heartburn. But there's another condition called LPR, laryngopharyngeal reflux. With LPR, the acid travels even higher, into the throat and vocal cords. That's why a lot of people with chronic throat mucus don't actually feel heartburn. Instead, they experience chronic coughing, constant throat clearing, hoarseness, irritation, even a metallic taste in the mouth. And because the symptoms show up in the throat, people think the throat is the problem. But the throat is usually just the victim. The real issue often starts in the stomach. Now, before we get into the root cause, let's quickly talk about the standard treatments. Most people are given antacids or PPIs, proton pump inhibitors. These medications suppress stomach acid, and yes, they may temporarily reduce symptoms. But here's the problem: they can also create a whole list of side effects: constipation, gas, poor digestion, mineral deficiencies, higher risk of infections, even problems absorbing calcium, magnesium, zinc, and iron. And what's crazy is that long-term use can actually make reflux worse over time. Because here's the part most people never hear. In many cases, reflux is not caused by too much stomach acid, it's caused by too little. That completely changes the way you look at this problem. See, stomach acid is not the enemy. Hydrochloric acid is one of the most important substances in your entire digestive system. Its job is to kill pathogens and bacteria, break down proteins properly, help absorb minerals, activate digestive enzymes, trigger bile release, and signal the valve at the top of the stomach to close tightly. When stomach acid is too weak, that valve doesn't seal correctly anymore. So now acid, and sometimes bile, starts moving upward into places it shouldn't be. The throat becomes irritated, and your body responds by producing mucus as a protective mechanism. That mucus is your body trying to defend itself. Now, another huge issue with low stomach acid is poor protein digestion. If proteins are not fully broken down, they create stress throughout the digestive tract. And if someone also has inflammation in the gut, what many people call leaky gut, partially digested proteins can trigger immune reactions and food sensitivities. This is why digestive problems often connect to inflammation, allergies, autoimmune issues, and chronic irritation. Everything is connected. Now let's talk about what causes low stomach acid in the first place. One major factor is chronic stress. Stress absolutely destroys digestion. Your body cannot properly digest food when it's constantly in fight or flight mode. Another major cause is frequent eating and snacking all day long. We've been taught that eating 6 small meals a day is healthy, but for many people that keeps the digestive system constantly working without any time to recover. This is why intermittent fasting can be incredibly powerful. When you stop eating for 16, 17, or even 18 hours, your digestive system finally gets a chance to rest, repair, and normalize. Another huge trigger is inflammatory foods, especially processed grains, refined carbs, sugars, seed oils, and ultra-processed foods. A lot of these foods increase inflammation in the gut and weaken digestion over time. And ironically, many reflux diets actually recommend eating more grains. But for a lot of people, grains make the problem worse, not better. They can irritate the digestive system, increase inflammation, and throw off the balance of omega-3 and omega-6 fats in the body. Now, one thing that can help many people is rebuilding stomach acid levels. A common supplement used for this is betaine hydrochloride. A lot of people notice major improvements in reflux, bloating, and throat mucus once they start restoring proper stomach acidity. But there's an important exception. If you have gastritis or an ulcer, adding acid too early can irritate the stomach lining even more. In that case, you first need to heal the tissues before rebuilding stomach acid levels. So don't just randomly throw supplements at the problem. Understand the mechanism first. The bigger message here is this: your symptoms are not random. Your body is always trying to communicate something. Chronic throat mucus is usually not just a throat issue. It's often a sign that digestion is breaking down upstream, long before more serious problems show up later. And once you understand the root cause, you can finally stop chasing symptoms and start fixing the actual problem. Subscribe to the channel and stay healthy.